Sinai Medical Foundation Oral History Project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Michael Burke, and today's date is November 6, 2023. I am interviewing Dr. William Leuchter. Dr. Leuchter, do you give permission to the Leonard N. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for uses as deemed appropriate by the archives?
I most certainly do.
Good. So let's start at the beginning.
Okay.
Where were you born, and what were those formative years like growing up?
Well, it's a long story.
Want to hear it?
I'll be concise. I'm Canadian by birth. I was born in a town called Hamilton, Ontario, which is about 40 miles from Toronto, Ontario. I went to school, graduated high school into medical school. Out of high school, which is a little unusual. I went to University of Toronto Medical School, and I graduated University of Toronto Medical School in 1970. So I had 6 years of pre-med and med within the medical school. After that, I interned out west, just outside of Vancouver, in a city called New Westminster, which is the capital of British Columbia, Royal Columbian Hospital. And I, at that point, knew I was going to be doing neurology, but I decided, since I graduated when I was 24, I was too young to finish my residency at 27, so I decided, or 28, so I decided to do a year of family practice, which I did in Windsor, Ontario. I paid off my loans, became financially solvent. At that time I was married. And then I did an internship, actually a residency, internal medicine residency at Sinai Hospital for 2 years, including my internship here at Royal Columbian. And then went to the University of Minnesota, where I was already accepted when I was doing my family practice in Windsor. I didn't finish in 1976 at the University of Minnesota.
What inspired you to become a doctor? Good
question. I can't remember any time where, as far as my memory goes back, I did not want to become a doctor. And when people ask me that question, I think when I was in the 7th grade is when I firmly decided. What made me become a doctor is difficult to enunciate. In retrospect, I think I just always wanted to be a physician because I admired my physicians, my pediatrician, my allergist. They were homespun individuals who cared about people and went out of their way, I saw even when I was a youngster, to help people regardless of their social situation. I think that probably was the main cause. My dad wanted me to become a dentist. I never wanted to become a dentist, but I always wanted to become a physician. And I think as time went on, I never even thought back about that. I was firmly happy that I became a doctor for all what I thought were the right reasons. I wanted to help people. I loved people. I'm a people person. So I got emotionally involved with my patients always. Sometimes to excess, some people might say, but not from my perspective. And I love the intellectualization, the acquisition of knowledge. So those two loves, acquisition of knowledge, becoming a people person and loving people and helping them, gave me a sense of satisfaction, both the academic stimulation as well as the people stimulation. So when you amalgamate both together, that's why you become a physician.
So describe your experience at medical school.
At medical school. So I went to medical school at the University of Toronto, which is, with McGill, probably the top-rated school in Canada, and very difficult to get into. And we had about 130 students, 140 students, and I would say about 40 or 50 were Jewish. At that time, and before that time, it was very difficult for Jews to be successfully admitted to medical school, particularly in Canada, which tended to be more rigid in terms of its quota system than other countries. But the school, the grade and the school in general was a fabulous school to learn medicine. Some of my teachers were J. Bolio Grant, who wrote Grant's Atlas of Anatomy, Jack Ham, who wrote, not Jack Ham, Dr. Ham, who wrote the histology textbook. So I had people who were pioneers in medicine teach us. Insulin was discovered in the University of Toronto. Similarly, I had courses at Banting Institute where insulin was discovered. It was a very great place to become a physician, and it gave me a very well-rounded education academically. It was quite competitive, and when we had our reunion many years ago, there were about 70 of us at our medical school reunion. I graduated in 1970. We all knew each other, so there was a camaraderie-ship there that was binding, and still to this day, very similar to Sinai Hospital in many ways. So I graduated medical school, and at that point, as I said, I went to the West Coast and did general practice for a year, which taught me a lot. I delivered about 100 babies. I did several appendectomies, several tonsillectomies. I practiced general medicine, set fractures, what a general practitioner in those years did. Can't do that anymore. But it primed me for being a physician as a neurologist, because it gave me experience in other areas that I drew into neurology. It made me appreciate people for a variety of reasons.
So then you went, as I understand it, you went for residency at the University of Minnesota?
Yes, I did.
So what was that like?
Well, Minnesota was after my internal medicine residency at Sinai. And at Sinai, I got a taste of what I wanted when I came back. So I went to Minnesota. I trained under one of the originators in neurology called Dr. Baker, who was Jewish, B. Baker. He started the American Academy of Neurology with 3 other neurologists in this country. And I became his chief resident the last year. And it was his last year of practice because the university at 68 made him retire. So I had the benefit of deriving all I could, and I meant my business to derive all I could from his experiences. Not his medical or neurological experiences only, but how he dealt with very important people, how he was able to assess personalities, and how he was able to integrate academics into political activism. He was a very political guy, and he was one of my mentors, and certainly I patterned my neurological life after him.
And so you did residency there and at Sinai. How did they compare?
Well, they're entirely different. Excuse me.
That's okay.
Sinai was a hospital-based residency through Wayne State University. And the university, as Toronto was, is a very academic center. Sinai was far more, how do I phrase this? Academic institutions tend to be stimulating academically, but not stimulating on a personal level. You're a student, you're a resident, you're there to learn. Sinai Hospital, you were both. You were there to learn, but you're also viewed as an individual. And particularly since I was Jewish, and of course Sinai Hospital was Jewish, and it was formed because of the dearth of physicians getting into non-Jewish institutions, there was a bond there that was always there, sometimes not stated, often stated at the end of my year there, but it was more homey. When I was finishing my residency at the University of Minnesota, we had the biggest residency program in the country at the time. We had 33 residents and fellows, and we had a big dinner where we all announced where we were going and why. And I had told many people who are still friends of mine that there's only one place for me to go, and that was the Sinai Hospital. I was going back to Sinai. And I told them why. A year after I came back to Sinai, I received a call from the University of Minnesota, a pediatric neurologist who was on the search committee. He wanted me to come back to become a junior professor at the University of Minnesota, but I just couldn't. For a variety of reasons, not only medical, but my family was here. But the bonds were not nearly as strong at the University of Minnesota, which I loved, as they were through Sinai Hospital, which I loved even more.
This isn't one of the questions, but I'm curious. I know Sinai was always number one in your choices. Did you explore other possibilities, and did you ever experience any resistance because you were Jewish to hospitals out there?
You know, this is a loaded question.
Well,
So, since you loaded the gun, I'll fire it. After I finished Minnesota, I returned to the University of Toronto to apply to go on staff at the University of Toronto Medical School in the Department of Neurology. And I was interviewed by the chief of internal medicine for a good length of time, who I knew because I had trained at the hospital that he was at. And he was very nice, very patrician, and asked me why I wanted to come back to the University of Toronto. So I said I trained there, I admired the institution, I wanted to be academic. And after a long discussion, he suggested that I might consider going to Mississauga, which is a city outside of Toronto, but that he didn't think there was a place for me there. He said it very nicely. I was aware that he was probably going to say it because a friend of mine did a nephrology residency at the University of Pennsylvania and came back and got the same reply. Mm-hmm. He was not Jewish. I was. Part of the lure of Sinai, so I came back to Sinai Hospital, which I never regretted, and living in the city of Detroit, which I loved and still do. Part of the reason, of course, for coming back to Sinai is because it was Jewish, and I felt a bond there that I did not feel at the University of Minnesota nor at the University of Toronto. I also felt, and I don't know if I'm correct in saying this, but I will tell you anyhow, that being British, growing up in the British system, I always felt there was some subliminal anti-Semitism. And my mother told me many years ago that before the war, Second World War, there were signs on stores saying no Jews allowed or go to a different washroom and so forth. Very similar to the African American situation in the 50s and 60s in this country. So I tried not to let that bias me, of course, but I was very happy in some ways. I was upset that he didn't let me apply for the University of Toronto, but in retrospect, it was a great decision on my part.
Your specialty in medicine, why?
Pardon me?
Why did you pick neurology as your
Why did I pick neurology?
as your specialty? Because you did a lot of other things in
I did internal medicine.
exploration.
I did. Well, I always wanted to be a neurologist, but I felt that I would benefit by doing some internal medicine first because it would widen my scope of expertise. Neurology is a very academic subspecialty. Most doctors say, well, if you're a neurologist, boy, I would never do that. It's too difficult. I never viewed it as being difficult. It's viewed as being a challenge. It's very mathematical. You have to have great deductive reasoning to be a good neurologist. And when I took neurology, CAT scanning wasn't available. And so one of the things that Dr. Baker, my mentor, taught all of us was how to make a differential diagnosis based on your senses and your clinical acumen and your intellect and your inquisitiveness and your knowledge base. And to me, those are all qualities that appeal to me. And I can tell you that when I was in practice at Sinai, no doctor knows everything, but every doctor knows where to look if he wants to. So if I saw a patient where I knew I was in the right ballpark but didn't know if I was in the right field, I simply went and did research and came back with an answer. And if I didn't, I'd call someone. I soon found out, after a couple of years, I would call some of the guys, professors at the University of Minnesota where I trained, and a guy named Milt Ettinger, who was also Jewish, and chairman of the Department of Neurology at Hennepin County General, said to me after a couple of years, Bill, I don't know why you keep calling me because I can't give you an answer. So what that taught me was that no one knows everything, but everyone can use their brain to the best of their ability to try and problem solve, which I did. That's what attracted me to neurology.
I'm kind of interested in when you got you sort of alluded to it, but I want to understand the camaraderie that you experienced at Sinai, and being Jewish, how that factored into obviously your decision to come to Sinai.
Well, let me answer the question about the camaraderie and being Jewish, because of course they're interrelated, right? They're basically interfused. One of the things, and one of the answers I gave to people who asked me in my last year in Minnesota is why I was coming back to Detroit was because of Sinai Hospital. They asked why. I said, it's a very, very unique hospital. It was academic. We had to do a lot of academic research in internal medicine. The chairmen and chiefs of the departments were academic, but they also were personable. I remember seeing Herb Ravin, who's the chairman of the Department of Internal Medicine, when I applied to Sinai, and the vice chair was a gentleman named Charlie McCune, who was a Harvard-trained internal medicine specialist who was in charge of education. And all the chairmen of all the departments, although they were tough guys and were good administrators, you always got the feeling that they cared about you as an individual, not just as a physician or as a cog in the machine. That was way more prevalent at Sinai. Not to say it wasn't also prevalent at university settings, but not as pervasive. So there was a feeling of brotherhood at Sinai, whether you were Jewish or not. It was a very diverse residency program. I would say that maybe 60 or 70% of the residents at that time were Jewish, but there were plenty of residents from Europe and South America who we all got along with famously well, who were very bright guys. And so the Jewish principles of tzedakah and giving back to the community, academic stimulation, and caring for people, most importantly caring for people, was instilled and imbued into all the residents, from all the attending staffs and all the chairmen. Not something that I found as pervasive at the university settings, and that's the difference.
Yeah, that was you factored in my next question, but I'm curious, there were clearly Jewish doctors at some of the other hospitals in the community. How was their experience perhaps different than being at Sinai and being Jewish? I'm sure you had colleagues
there were
friends.
Jewish doctors at Mount Carmel when it existed, at Beaumont, of course, at Providence, downtown at DMC, and the chairman of our department at DMC was associate professor with Bob Lysak, who was Jewish. He's a neuroimmunologist. He's still alive. A great doctor, wonderful guy. Those individuals were warm individuals. You could have plenty of non-Jewish heads of departments who were also very warm individuals as well, but it wasn't the proportion. It wasn't the density. And one got the feeling that if something happened, you could always count on the guys at Sinai, whereas if you're an individual, whether you're Jewish or not, at other institutions, you weren't sure you could count on them because they had to perhaps ask advice or permission from someone else who may or may not have been Jewish, who wasn't imbued with the same sense of commonality that we had.
What positions did you hold at Sinai Hospital through the years?
When I came back, 1976, I, of course, went on attending staff, and I wanted to teach. So I immediately went into the teaching aspect of my private practice, where we amalgamated private practice with being a teacher at the hospital. I was in charge of the neurology teaching program, and I attended morning report for internal medicine once or twice a week at, I think it was 7 or 7:30 in the morning for an hour or so. And then I taught the residents for about 3 or 4 hours on the consult service. And then I did, in the afternoon, my private practice. I was also in charge of bringing in guest lecturers from various different areas in the country to Sinai Hospital on ground rounds, and also in charge of providing teaching materials and lectures to the residents throughout the year. And I was able to coordinate the clinic as well. We ran a free clinic Wednesday morning for the community, a neurology clinic, and I was the coordinator there, so I had to coordinate the 6 or 7 neurologists we had at Sinai to cover the clinic on a rotating basis. So I had to set up scheduling and make sure people fulfilled their responsibilities and so forth. In 1983, I became chief of neurology, and I remained chief of neurology until Sinai Hospital was sold. I think it was 1998 or 1999.
Yes, you're right.
And my responsibilities were the same. I didn't change. I had a little more administrative responsibilities, but basically, I never gave up the teaching responsibilities, even though I still also had private practice. So I did both, which wasn't easy at times.
Did you sense any change in the culture from when you started at Sinai to when it closed at the end?
I think the desires of the physicians to perform, to practice quality medicine was still there, but the constraints are much more difficult. They were difficult for a variety of reasons. One were insurance issues, which will always be an issue. And two was the perception within the Jewish community at large that Sinai was not the place they wanted to be because of social issues, of cultural issues. And it was difficult. I remember the last several years when I would see a patient and have them come into Sinai. At that time, I felt neuroradiology was probably one of the best in the city. And I didn't want my patients going somewhere else where I couldn't be sure that they were going to get quality care. Probably would, but I wasn't sure about it. Whereas I knew the individuals at Sinai, but it was more difficult. So there was a difference in culture from without. At Sinai Hospital had made a decision in 1977 or 78, perhaps 79, not to build out in West Bloomfield with Henry Ford Hospital.
Do you think that was a mistake?
That was a mistake. They wanted to serve the community, which was not a mistake. They could have stayed at 7 Mile or Outer Drive area and amalgamated with Ford out here to provide service to the community out here as well. So I think it was an error in judgment in retrospect.
Mm-hmm. What was the thing you enjoyed most about working at Sinai? I hear there were a lot of things that you
It was
enjoyed.
fun. Every Christmas we'd have a Christmas get together, and there were about 5 of us: George Bloom, myself, Donnie Blitz, and the Levinson boys, and I think that was it. And we would always perform a number of skits on stage.
I would have liked to have seen that.
I don't know if they filmed it or not, frankly, I don't remember, but we would practice for about a month, writing and singing songs. I don't think we were any good, but it was fun. And that was part of it, right? And I think the best part of Sinai Hospital were a couple things, I would say. One, from an academic perspective, there were times I can remember where I would say to Dr. Brown, as an example, Bill Brown, OW, who was a vascular surgeon, and he would see a patient for perhaps a neurological problem on a vascular basis. And of course, I would see the patient neurologically, and I would say, and I also would say this to Laurie Worthland, who was a wonderful man, a vascular surgeon as well. You can't operate on this patient for some reason. I don't remember what the reason was, but we would have Tuesday afternoon rounds in the auditorium where we would present neuroscience cases, difficult cases with Harvey Gass, the vascular surgeons, neurologists, neurosurgeons. And I moderated the program, and I remember saying to Bill Brown on one occasion, you can't operate, and we had this huge academic argument, but we were friends. Didn't stop us from arguing. And I remember Harvey Gass, who was the chairman of neurosurgery, who was a wonderful neurosurgeon, who I presented a case of a lady who had terrible carotid artery disease, and that was before the studies had come out saying surgery was somewhat better than medical therapy, which is not true anymore, but it was at that point. And I said, Harvey, if you don't operate on this patient, she's going to die. And he sort of smiled at me, and Harvey was, he once told me the first year I started at Sinai Hospital that I shouldn't make any decisions when I would say things like that to him until the skin behind my ears was dry. I still went behind the ears. So we had fabulous arguments academically, which stimulated us all to read and to become more informed. But we still liked each other and we respected each other. So there was an element of respect academically and camaraderie and friendship socially. And of course we had that communal bond of showing up at synagogue for Rosh Hashanah and Yom Kippur, celebrating Hanukkah, Purim parties, festivals that had Jewish content.
Did the non-Jewish physicians participate in those?
Yes, they loved it. Roy Worthland was a Salt Lake City guy, and he came from Mass General. He loved Sinai Hospital, and he had 17 kids. And the first year he joined it, he sent me a Christmas card with 3 kids. and the next year was 4, next year was 5. So it was 1 card, and opened up to 2, to 3. The last few years, he sent me a book with 52 grandkids with all his
Wow.
friends. So he loved Sinai Hospital because of the same reasons I did. So you didn't have to be Jewish to love it. It had a certain tum is the best word. It had a certain tum to it that was sadly lost when it was sold. All of us felt rejected in some ways, dismissed in some ways, and disappointed in some ways.
When did you find out the hospital was going to be
But
sold?
we had formed a committee of about 20 to 30 physicians that met in the boardroom, I think once every few weeks, the last year or two, to see, as Sinai was losing money, what we could do to stave off the sale of Sinai Hospital. And we would make certain suggestions. I was on the committee. And then there was, of course, an executive committee from the regular committee, which I was not on. But Mel Rubenfire was on that committee, and some other individuals as well.
Was there interaction between the two committees at all?
Oh, I believe there was. But it was determined that what we said wasn't important enough, as the reasons why we wanted Sinai to continue weren't important. The reasons I just gave you for the last little bit were less important than other issues.
Did you feel betrayed by that at all?
Yeah, I think we all did. I remember Ron Trunsky, who Shalom just passed away a few years ago, great guy, and we would talk about this a lot. We felt, I think betrayed is, it may be a good word. We felt that there were other principles involved that were more important than financial issues. The Federation obviously didn't, or whoever was in charge of the finances initially. And so when Sinai Foundation was formed afterwards, I thought that was a great legacy, a great idea.
But the decision to sell the hospital, there was a demographic issue, I think, associated with that.
Yeah.
The Jewish community wasn't coming.
That's what I
to
said in
Sinai.
1978.
Exactly.
When Sinai decided, I thought that was very short-sighted. I remember Arnold Axelrod and I met, and he said, "What do you think?" And I said, "I think it's a big mistake." And that was late 1970s. And he said, "Well, they decided what they decided." And I said, "Arnold, I think that's a mistake." He said, "Well, so do I," but he felt helpless.
What was the atmosphere at the hospital, particularly among the doctors, when this whole sale process started going on, and you still had to practice medicine in the hospital?
Yeah, we did the best we could, but we knew our days were limited, and there was a migration to join other staffs to protect their self-interest. In addition, there was a sense of anger, of course, which fits into that betrayal definition. Not against. It was a free-floating anger. It was against everybody and anybody who was associated with the sale, but not the individuals, the group. So there are people on the board who were promoting this, who are still my friends. I still am friendly with them, and we get along great. But we were angry because we felt that Sinai was special, and obviously other people didn't. It was a mistake, I think, for Sinai to move to Sinai Grace.
Yeah, I wanted to ask you about that. What was the environment like there?
So I remember when Sinai became Sinai Grace, or Grace became Sinai Grace, I remember that Stephen Lansky and Chernak group didn't even join Sinai Grace. They immediately went to Beaumont. Great cardiology group. I remember Sam Minnebaum telling me the same thing. He just couldn't take it for some of the reasons we've talked about, the emotional reasons, the social issues, but also the academic issues. And I stayed and tried to be a chief of neurology there for a little over a year, maybe 2 years, and it was very discouraging. It wasn't the same. When I would go into Mel Rubenfire, who became chairman of the Department of Internal Medicine, and before him, Arnold Axelrod, they were sympathetic and would listen, and you knew they were trying their best to make the right decision. We never got that feeling at Sinai Grace. There was not the sense of fellowship, of camaraderie. It was more disjointed. The doctors were not cohesive as we were at Sinai.
More impersonal?
Much more, way more impersonal. And you didn't get the sense of caring. Maybe I'm biased, but you didn't get the sense of caring. I remember one time I went there with the residents, and we were doing rounds. And I said, let's go down to X-ray and look at the, whatever it was, CAT scans, I think it was. And we went in, and I asked the lady to pull whatever I asked her to do, and she wouldn't do it because it wasn't her job. And then another issue, when I remember, was in the emergency room seeing a patient with renal failure, very sick. And I asked the ward clerk who was sitting where you are sitting if she could hand me the chart. And I don't remember what she said. It was something along the lines of, why don't you just get it yourself? And I walked out and I said, that's it, I'm gone. That would never happen at Sinai. If it did, it wouldn't last more than one issue. It would have been dealt with. Now, I'm not saying it's not a good hospital. I'm saying you don't get the sense of caring that I got at Sinai, nor the sense of responsibility. It's a community hospital. It serves the community. So, at that point, I said I can no longer be chief at Sinai Grace. And that pretty much summarizes the difference, I think.
Through this discussion that we're having, you've mentioned a lot of names, but I'm curious, who are those mentors that you really relied on over your career that you really turned to when you needed the answers that you needed to hear?
Well, my primary mentor, of course, was A.B. Baker, who was in 1948 started the American Academy of Neurology to join the American Academy of Psychiatry, amalgamate. It was during the polio epidemic, and he and Saws and Forster and Geschwin and one other chairman formed the American Academy of Neurology, which now has thousands of neurologists. And he certainly showed me what I thought what a physician should be like, as well as an administrator. Powerful guy. At Sinai Hospital, I can't think of one person. I can name all the departments. Eli Brown. I loved Eli Brown. And Mel Rubenfire. I'll tell you a funny story. Mel became chairman of cardiology, I think about 4 or 5 years before I got there. And I came there to do internal medicine. I had treated a patient that he thought was incorrect, and he was making rounds on 3 North, and I remember he was wearing black dress boots, and he didn't know me at all, but he knew my name because I had made a mistake. And he came up and he told me on the stairwell, I admit it, he was very professional about it, very diplomatic, but very firm. And I walked away saying, oh, there's a guy who knows how to handle people, and I'm going to be like that. Now, Rubenfire, Eli Brown, Charlie McCune is an academic from Harvard who taught the residents academic internal medicine. Ron Trunsky in psychiatry, Rosenzweig in psychiatry, Saul Sakwa in general surgery. All the chairmen were great. And I wanted to emulate those guys. And I felt I could, and I think I did.
Pretty sure you did.
Yeah, so I mean, those were all great choices. Those are the guys that stood for Sinai Hospital. They were the pillars of the medical community in Sinai Hospital. And they deserve to be.
So the hospital was sunsetted, but the foundation was created.
It was.
How do you feel about that?
I think it's great.
Tell me the role that you played, or are continuing to play for that matter.
Well, I was an initial member of the foundation, but about 3 years ago or so, maybe a little longer, I was out for dinner with, I'm blocking the name because of my age, I'll think of it in a second.
Welcome to my world.
And he mentioned that he was on the foundation, and they're looking for people. He wasn't cultivating me particularly, but I cultivated that. So, well, I would like to join. And so he put my name for nomination. I became a member of the foundation. Now, I missed a few meetings because of medical issues, but I think it's a wonderful. It serves a very useful purpose, a multi-dimensional purpose. One, it keeps Sinai and the legacy of Sinai Alive. Two, it distributes funds from the Sinai Foundation to worthwhile institutions, whether they're Jewish or whether they're not Jewish, it doesn't matter. And they're all treated equally. So it shows the community that we're philanthropic medically, and that we continue to do so. Because after all, that's giving back to the community is one of the foundations of Judaism, really, right?
Correct.
So that's what Sinai Hospital represented, and that's what the legacy should be going forward as well.
And you're happy with the kinds of decisions that the foundation has made over the years?
I think so. Now, I'm not aware of the foundations from 15 or 20 years ago, but I am in the last several years, and yes, I am.
So tell me, just mention a couple of the things that you funded while you've been
Well, they're
on the
still up.
committee.
Well, in fact, they had a meeting in October, which I unfortunately missed again. But we have, to give you an idea, we have grants going to, or evaluating grants from Ford Hospital, Providence Hospital for their different areas of expertise. One's for Alzheimer's disease, one's for cultivating the community around them to make health issues more accessible on a non-medical basis, organizational issues. We fund grants for the evaluation of dialysis and so forth. So the medical as well as cultural grants that we fund. Some we turn down because they're redundant or we don't think they're as important as other ones as well. But everybody gets a fair shake, and everybody on the board votes.
Are there some areas that you would like to see the foundation address in the coming years that will, I know that the foundation, their goal is the enhancement of quality of life. So I'm curious if you have some ideas in your own mind of some of the things that could be addressed in our community.
Well, the biggest issue is aging, and the issues of age and medicine and diseases of aging as well. In my particular instance, of course, it's dementia, particularly Alzheimer's disease, which we've assessed in some of the grants. And other than that, no, I think the spectrum is too wide to really be more specific. But from my perspective, it's all the issues associated with aging and convalescent and chronic care facilities and accessibility for people who don't have money to be treated on equal basis. Those are all things we look at.
Is the foundation addressing those
Yes,
things?
yes.
And you're satisfied with the attention that's being paid to those things?
Well, we're all serious about it, yes. I think we're serious about the attention. I don't know if we're successful in dealing with it on a wide scope. No, I don't think we are, but our contributions are not inconsequential.
But the foundation is hitting at a major league level,
It is.
sounds like.
It is. Yeah, there are some areas where we've given a fair amount of money, more than you would think. And all of us have agreed to it, basically, without getting into specifics of it. So I think it's an extremely worthwhile endeavor. Yeah, I'm very proud of it.
Anything we haven't covered, Bill, that you'd like to address in our closing moments?
No, I'm sad that Sinai isn't around. We all used to call ourselves the diaspora, the Jewish diaspora, the Sinai diaspora. We had a get-together at a golf club about 10 or 12 years ago, and there were hundreds of physicians there, and we all were sad, but we all were happy to be together. Ron Tronsky put together at that retreat a video, and I forget the name of it. I think it was called The Ballad of Sinai Hospital. It was brilliant, and that should be within the foundation's.
You should
find that as well.
We will look for it. I mean,
it
it belongs in the archives.
It belongs in the archives. It was a brilliant video, and it was it captured the essence of Sinai Hospital in many ways. So I enjoyed this interview.
As have I. It's been a pleasure.
Yeah, and I'm so happy I came back to Sinai Hospital.
As are we.
Well, thank you. Thank you.
Thank you very much for your time.
You're welcome.
It's very
My pleasure.
greatly appreciated.
My pleasure.